Hi, my name is Dan, and today I wanted to talk about the supplement called SAMI, S-A-M, all capital, and then lowercase e for the treatment of depression. Thank you for tuning in. So SAMI is a molecule that's made naturally in the body. It is involved in a number of chemical reactions that take place. It's involved with the synthesis and activation of certain hormones, certain neurotransmitters, and certain proteins as well. The specific mechanism of action for its antidepressant properties isn't completely understood. It's involved in the production of certain neurotransmitters, and especially it has some link to serotonin. It has some serotonergic effects. It's also involved with the turnaround of serotonin, so the degradation of old serotonin and the creation of new serotonin. And then it also has dopamine and norepinephrine effects. So just like prescription antidepressant medications, prescription antidepressant medications also work generally on serotonin, sometimes have a norepinephrine component, sometimes have a dopamine component. So there's that similarity there. The production of SAMI is also closely linked to vitamin B12 and folate metabolism, which also has roles in depression. And SAMI may also alter cell membrane fluidity so that chemicals are able to be transmitted more efficiently and more quickly, which also may explain some of its potential effects on brain transmission and depression. And the final part that I found about SAMI that was interesting is that one trial I looked at suggested that SAMI may alter bioenergetic status. I'm not an expert on this type of verbiage or what this means exactly, but it looks like SAMI may have some effects on like blood flow and metabolism of substances in the brain. So again, increasing that efficiency of what's going on. SAMI is generally dosed between 800 milligrams and 1600 milligrams daily, but some of the trials that I'll highlight in just a second go even above that. It's best taken on an empty stomach, and most of the evidence that I saw seems that splitting up the dose might be best as well. So take half in the morning, half before bed or at night. The first trial that I wanted to highlight compared SAMI at a dose of 1600 to 3200 milligrams daily to a prescription SSRI called escitalopram or placebo. The Hamilton Depression Rating Scale was used to compare remission and response. So response to an antidepressant is generally defined as a decrease in your depression scores by at least half, so 50%. And then remission is when almost all of the symptoms of depression go away. So in this trial, the response rate was 45% of the SAMI patients, 31% of the escitalopram patients, and 26% of the placebo patients had that 50% reduction. The remission was seen in 34% of the SAMI patients, 23% of the escitalopram patients, and only 6% of the placebo patients. So compared to a FDA-approved antidepressant medication, this trial, although slightly small, 144 patients, did show some pretty decent benefits with the SAMI. It's particularly interested by the remission rate, which is the goal in treating depression. You want almost all the symptoms to go away. A second trial that I wanted to highlight compared SAMI with imipramine, which is a tricyclic antidepressant prescription medication, FDA approved. And what this trial saw was comparable efficacy, so both did the same in regards to how effective they were at treating depression, but the SAMI had much less tolerability issues. So there were less side effects and less issues with taking it, which is extremely important in antidepressant medication reviews. So those first two trials I talked about showed the efficacy evidence. There's more than that, but there is that block of evidence showing the efficacy. The next three trials that I wanted to go over quickly just show specific parts of SAMI trials that I'm interested in. So one sub-analysis review that I looked at showed that depression scores in males were decreased by 4.3 points on the depression scale that they used, but they weren't able to see a difference in females' depression scores. So like I was saying with the mechanism of action of SAMI, there's some hormonal components. So there might be some differences between males and females. Fourth trial that I looked at sexual dysfunction and to see if SAMI could treat sexual dysfunction. One of the common symptoms of depression in and of itself is sexual dysfunction, and that's a common question on depression screening scales and other tools like that. And then additionally, a lot of the antidepressant medications used to treat depression are associated with sexual dysfunction as well. So this is of big concern with treating depression. And this study that I looked at showed that men treated with adjunctive SAMI treatment, so they were on SSRI prescription medications, they added SAMI to their regimen, and those men showed lower arousal dysfunction and other sexual dysfunction scores as well. I think there was one other sexual dysfunction score that was shown to be a little bit better with the SAMI treatment. So it might work better in males than females. It might have some sexual dysfunction improvements. And then the final piece that I wanted to comment on was a trial that looked at specifically the cognitive impairment effects of depression. So sometimes people with depression have some fogginess and have some difficulty remembering, and their brain isn't functioning as well as it used to. And not a lot of things seem to impact the cognitive effects of depression. But one trial, small trial, 46 patients that I looked at with SAMI, showed that there was a greater improvement in the ability to recall information and in word finding abilities with the SAMI. So small and new emerging potentially evidence, but I just wanted to highlight that as another difference that SAMI might bring to the treatment of depression. So next is safety. SAMI seems to be mostly safe. It's been used in trials cumulative of over 22,000 patients, and there haven't been any serious toxicities linked to SAMI. I'm not saying that there aren't side effects. Any product can have potentially side effects. The most common ones seem to be the normal side effects that substances can cause. So nausea, vomiting, diarrhea. There don't seem to be, like I said, many serious side effects. When used for depression, there might be a link to causing hypomania or even a manic state. So sometimes in people with bipolar disorder that are being treated like they have depression, and this happens with prescription antidepressants as well, it can work too well on their depression symptoms and flip them all the way over into mania. So that might be a potential concern with SAMI as well. As for medication interactions, there's listed on Natural Medicine's database a significant reaction or interaction to prescription antidepressant medications. So both have that serotonin component to it, so that can be cumulative and lead to something called serotonin syndrome. Like I said, some of the trials that I looked at had SAMI being used as an adjunctive treatment, so that might be something that you can talk with your doctor or your prescriber about, and it might be okay to use in certain circumstances. Second medication interaction is with levodopa. So SAMI is involved with a lot of metabolism of substances and certain metabolic processes, and it can degrade levodopa, which is used for Parkinson's disease. So it will make levodopa less effective than it could be. SAMI seems to be difficult to formulate into a stable salt. So there's two different formulations that I saw that's available to buy: the toisolate formulation or the butane disulfonate salt. The butane disulfonate salt is more bioavailable and more stable, so it's able to have a longer shelf life. So due to those two reasons, that's the product that I decided to give a try myself. I went by the old adage to start low and go slow. So I started with 400 milligrams daily with a goal to get up to 1600 milligrams split into 800 twice a day. After the first few days of taking it, I noticed a little spike in my anxiety. I felt a little on edge. And with products and even prescription medications that affect serotonin, that can happen. And that seemed like it did happen to me. One of the purported benefits of SAMI is that it's supposed to work quickly, whereas prescription antidepressants can take weeks or even months to exert their full effects. And I didn't seem to notice that with SAMI. It took me a few weeks to get to a point where I noticed my mood, motivation started to go up a little bit. And it was only a mild, modest benefit for me. So due to the price and due to the mild, modest benefit that I was getting with it, I only took it for the month or two that I did take it for, and then I decided to get off of it. I've had better luck with other supplements that I tried, but I know that each person is different, so other people may have had profound benefit with SAMI. The product that I used is right here. It's 400 milligrams of the SAMI butane disulfonate. Another benefit of this product is that it's individually foil packaged, and due to the concerns with the stability, it's not an open bottle to the air each time you take a dose. It's popping it out of the foil. It touches the air for a few seconds as you take it. I did notice a slight bit of like a sulfur smell, which is expected with the product, but nothing too bad. The taste wasn't anything as you swallow it, so I didn't notice any issues on that end. So I hope that this quick review of the mechanism, some of the evidence, and my experience taking SAMI was helpful. Thank you for watching.